The following program is being presented to you by a community producer. The statements, views, and opinions expressed are not necessarily those of ALC-TV or the City of Avon Lake.
Welcome to Common Sense. Common Sense is a series of shows that features interviews with interesting people so that we can learn who these folks are, what they do, and what makes sense to them and what doesn't. I'm Rudy Breglia, and today I'll be interviewing Mark Adams, a veteran, very experienced health commissioner at Lorain County Public Health. Welcome, Mark, and thank you for your service.
Thank you, sir.
Okay. Mark, to start us off, why don't you give us some background, where you were born, where you've lived,
Sure.
What brings you to Lorain County?
Well, always from Northeast Ohio. I was born until 5 years old in Akron, Ohio.
Okay.
And then my family moved to Canal Fulton, so a small town in Stark County.
I'm familiar with that.
Yeah, and it's and I just, by the way, I was born on July 25th, 1969. So today's my birthday. So
Well,
best
happy
birthday gift ever was you
birthday.
telling me that you interview interesting people.
Okay,
So,
all right.
yeah,
Well,
so best birthday gift.
Happy birthday.
Thanks. And so it's both. Going through the family piece, you'll find out when we're talking about why I take things so seriously. So I lost my mother when I was 4. She was 26 to cancer. Also lost a brother in a vehicle accident, another brother to drug overdose. So those are three things that I get very wrapped up in as a public health person. But so the aspect of just where I'm from and the family has just always been Northeast Ohio. I always say I'm not fond of the snow, but I haven't made any decision to move out of the area. So I stick around every year, and I just find myself loving it, even when today was a great day at work and what it is that we're doing there. And and how I got to Lorain County, well, I mean, public health was an accident for me. I originally went to school to go to pharmacy school, and
I'm a pharmacist.
Yeah, are you? So I went to Toledo, and I realized that I just hated it. It was the retail piece that I was doing when I was 15 years old, working as a soda jerk in a pharmacy, and I made the sodas and did the hamburgers and light lunches and stuff. That I worked the counter, and then they brought me back, and I was doing prescriptions. And I thought, okay, this was a great job to do for a while, but then I realized later on that even after I left for the service and came back and was going to college, that I wanted to be in law enforcement. And my wife at the time said she would, girlfriend at the time said she would never marry me if I was a police officer. And she said she didn't want to have to worry all the time. And so I did the second best thing, I guess, closest thing, but never really said anything. I got into the EPA and working as an air pollution control person doing environmental enforcement.
Wow.
So I never really said, so that was the in. It was sort of being an environmental health police officer. And then the position opened up later in the same department. I was in Canton for a long time, 24 years. And that was a director's position, so I took that, and that was the foray into public health.
Okay.
And that's how I started the public health realm. And you had asked me how I got to Lorain, and how I got to Lorain was a phone call. I wasn't looking for another job, and I was the health commissioner in Henry County.
Okay.
And the health commissioner here in Lorain asked me, hey, do you want to move back to Northeast Ohio and back with your family? And I said, yeah, okay, I'll come out and apply for the job. So,
well, the question I was going to ask you was, what sparked your interest in public health? And if you could expand a little bit on that.
Yeah, to expand a little bit on it was, it really started with an event that had happened when I was 19 years old in the Army. And I saw that there was a soldier that wanted to be a pilot so bad. We're still friends to this day, but he wanted to be a pilot and he made a mistake. He was late for a formation.
Okay.
And the sergeant was, I thought, insanely cruel to him, where the threats were made that he was never going to get to be a pilot, that he was going to pull his school papers to get to flight school. And it really just upset me so much that I did something, I was insubordinate, and I absolutely yelled at that sergeant. I completely tore him apart in front of the command, and I didn't care what happened to my career at that point. And I got into a lot of trouble. And my
imagine so.
My friends made me a big stick called the shaft, and because I was digging latrines, I was doing everything.
Yeah.
And that was the first time I didn't realize that when it came to protecting people, that it was in me. So my brother had already all those things had already happened to me, but I didn't realize what that caused inside. And when I started over on the environmental protection side, there was an event where I saw that a neighborhood that was predominantly black had a company that was polluting in there, and really not a lot of action was taking place with this, with enforcement action against this company.
Right.
And so naturally, I jumped on top of that, and I made sure that I wasn't going to let it go. It became a personal mission of mine, and when that job opened up on the public health side, leaving the environmental protection piece and going over to the public health side, I saw, can I actually make a bigger difference in more communities by doing that? And that's where the spark of public health came from, I thought I could do more from this position on this side of the fence than I could from any other.
Wow, that's terrific. I was going to ask you what's the most interesting part of public health.
Today was a perfect example. So when it comes to the most interesting part, if people were to check out our website and what happened on July 25th at the Lorain County Public Health Department, we had this farmers market. And so this is indicative of what public health is, just this event today. And each year this is where you're offering from farm to table food. And we have local farmers come in, and so they're selling their vegetables there. And then we set up booths all around to tell you not only what public health does, but we have events and little things that go on for about a 4-hour period to work with the community and just show them what it is that public health does. And it's solely there to protect you. That's all this. So that's all this department does, is make sure that you can have a healthier life. And so they were, just watching these families walk around and seeing the children, that is the most interesting part to me. I love that. I love the education piece. I love working with the children, with the families. And it's one at a time. The more that they learn about public health and how even just the history that's behind public health and why we have sewers and why we wash hands.
Yeah, right.
Just seeing that is, you can see that you can change a society by that.
Understand, make them healthier anyway.
Yeah, that's the most interesting part to me, because you can watch someone's ideal change as to why their habits and why they would change them to live healthier lives.
Okay. What surprised you about public health activities?
So for surprising, it was when I would go into houses that severe hoarding. And the first shock that I had was probably about 25 years ago, when I would go into these houses and I asked a person, the owner of the home, the resident, I asked her how many cats she had, and she said 7. And what she kept doing was she would go 1, 2, 3, 4, 5, 6, 7, and then start over. Well, she had literally over 80 cats,
I see.
But she only saw 7. And so that was the first time that I was on the job for about 10 years. I've got 30 years in, and that was the first time, the surprise to me, that there's a huge mental health component that is also part of public health. And back then, they weren't calling the hoarding piece under the mental health aspect. They didn't do that until about 15 years ago. So public health was working on those cases. And we just started that program again at the health department on April 1st. And literally the second house we walked into was a house that was filled with garbage and debris and human waste and things like that. And just seeing the surprise is seeing how an event in a person's life can skew their sense of reality on what they perceive as normal or not, and what's acceptable or not. And you're working with them to try to help them and get them back into society, snap them back in, and try to take care of the mental health piece and work with mental health professionals. So that would be the surprising one.
Okay. What are some general common sense, I use common sense here,
Sure.
rules that people could follow to help them have a healthier life?
For one, don't be afraid to talk about something. I come from a family where when my mother died, we didn't talk about it. We also never talked about cancer. And when my brother died, we didn't talk about it. In fact, what my parents did is they left Ohio and went to Florida. And we pretty much stopped Christmases. It was, we're not going to talk about it, we don't bring them up, we don't do these things. The number one biggest thing, I mean, there's all those little things, the personal health habits, stopping drinking, the smoking. The biggest thing is if we don't have the courage to have a conversation about something that's happening, get rid of the bravado, get rid of the ego, we will never fix anything. You can stop drinking, you can stop smoking, you can stop all those other things. Stop eating, but you'll never still stop diabetes. You won't stop any heart disease, you won't stop cancer, you won't stop stroke if we don't get rid of that bravado, that machismo to actually break down and have a conversation. Admit that something's hurt, because my uncle just passed away in February, pancreatic cancer, refused to go get screened. And it was, I'm not going to do it. I'm going to ignore this pain because I'm tough. I'm a tough guy. And it was 9 months of excruciating death for him, and going through the Whipple procedure and everything else. But near the end, then he wanted to talk about it, but not very much. It was, if my parents were around, and they're still hurting from my brother dying from 35 years ago, but if they were around, the conversation would end. So I purposely, and I know people would be watching this, would be thinking maybe I'm cruel and inhumane, is I purposely bring up my brothers often. I will call my parents. I did it today. Of course, when I was talking to them on my birthday, I was like, hey, Henry and Kenny called me also to wish me happy birthday. And my dad will laugh now. My mom thinks I'm a little weird with that, but that's, the number one thing, I have one thing, and that is you got to have the courage to have a conversation.
Now, I think you've covered this already, but if you had to, what's the most important health choices that people can make in their daily lives? And, I think you're alluding to smoking and drinking as pretty close to the top of that.
Lorain County, as well as Ohio and the rest of the states in our great country, are having a huge problem. One is that we've never actually we've never decreased our drinking whatsoever. We have continued in this state to drink more, drink more, drink more, drink more. There is absolutely, every study will show that there is a link between drinking and the probability or possibility of getting cancer. There are, some studies out there show that there's benefits, but there is no study that says that there isn't an increase of risk with drinking. So there is a temperament piece, but we continue to drink more as a society. The other thing would be is that we're not paying attention to our diabetes, and we're not paying attention to our weight. And that is increasing our stroke, that is increasing our cardiovascular disease, that's increasing also our cancer, every single one, our infant mortality. We are actually getting unhealthier as a community, not just in Lorain County, but in Ohio and in this country. We're a first world country, and we shouldn't have the infant mortality rates that we have. We shouldn't have the disparities in rates and diseases that we have. In almost every disease that we've got listed in Lorain County, Black populations experience that disease more. We shouldn't have that. We should have, it should be equal access to medical care. It should be equal access to insurance. It should be equal access to courage to have the conversation with a doctor that says, I'd like to be screened. Equal access to be able to get screened. That's not the way it is. And that's not what's happening. And we just don't, whenever I talk to somebody about it, they're very receptive. Whether I talk to the politicians that we have in the county, I feel that every time I'm having a conversation with the Lorain County politicians, they are listening to me. So, and they really do try, okay, well, what can we do? And so they really do try hard. It's really getting that message to the people to say, look, you have your freedoms to do whatever, but at least listen that these habits will cause this. And it's the burden that's being placed financially on our medical system. We're never going to fix the medical system if we don't fix what we're doing to our own bodies.
Understand. What are your, before we leave that, what are the social determinants of health that affect the health of Lorain County residents?
Sure. When people, if we have to look at what's going on around us instead of we're not really in a bubble. Everything affects us in some way. So, for example, there are 5 factors. What are the access to hospitals, the access to good schools, the access to neighborhoods in the built environment, to jobs, that economic stability. And when you look at those factors, those social determinants, that when a person or people don't have access to good schools and a good neighborhood, that you can see their health is in decline. It's a direct proportionate relationship. And so what we've done is tooled the department to really just focus on each one of the divisions that we have. So a health department is, you have your health promotion, you have your nurses and community health, you have your environmental health division. Each one of them, each of the directors were tasked with looking at an employee and saying, your social determinant of health that you're going to be focusing on, that your job shall have some direct effect on, is going to be, you're going to be working in the built environment piece. So any part of your grant shall have at some point a tie-in to this social determinant of health, because they are directly related to health outcomes.
Right.
So that is the objective, is to tie the department and working with our partners, the hospitals and everybody else, and also that social determinant of health awareness, and saying, listen, we know what's causing this. We know what the 5 factors are, so we're going to make sure that everything that we do is tied to those social determinants of health in some way.
Okay. What are your major responsibilities as health commissioner?
Health commissioner is the executive position of the department. It's the secretary of the Board of Health. So the position was born back in the early 1800s with city health departments, because county health departments didn't exist until 1919. It's just the executive piece where during the board meetings, normally back in the day, the health commissioner would take the minutes and put together the packets and run the department as the executive director. Now, usually there's a little bit more, it's a lot more detailed, so usually you have another staff member that's doing that piece. But I'm the direct link between the people in the community and the staff. They're also a direct link between the people in the community and the staff, but usually with our partners. And also a direct link between the Board of Health and the staff, and then a direct link between our elected officials, this Board of Health and the staff. So that's, my job is mainly, it's mainly administrative. I love to get out though. That's why I was directing traffic for 4 hours today. Yeah, I love to get away from the desk, and I love to be interactive with people. And but it's an executive position, so it's running the department the day-to-day, making the decisions. If somebody says we're going to be working on this plan or doing this, what do you feel about that, Mark? I mean, I've got great staff, so I've told them, you don't need to be asking me for permission all the time. Just let me know what it is that you're doing.
Okay.
So,
a coach.
Absolutely.
Okay. Well, what prepared you to be the health commissioner?
I learned my compassion piece, because compassion is the biggest piece. I learned the compassion piece when I was in the military, and being around people that did not have, and seeing things from their eyes and making sure that whatever I needed to do, I was going to make it better for them. So I learned the compassion piece then, because I was a pretty self-centered kid. And you can learn compassion even if you're self-centered. I learned the financial piece while I was working in Canton. That's where the grants management piece and then the fiscal aspect of it. So I learned that. So when I became the health commissioner in Henry County, I knew I could run the books. So I was pretty efficient and effective at doing that. So I knew how to be fiscally responsible. So when coming to Lorain County, it was it's Henry County on steroids. It's a much larger department, 130 people, much larger county, 26,000 compared to 310,000. So I wasn't worried about taking the job at all. I was excited. The biggest piece was you're going from one person to another. So how are people, they've had one person for 10 years. How are they going to work with somebody that is I'm a little bit more hyper, so it's, what are you going to be like with my energy? And it's the one thing I tell everybody, and I've said this forever, is that I'm a person that will never ask somebody to do something I'm not willing to do myself. So I was directing traffic and I was picking up garbage today. I will never ask anybody to do it. They see that. I don't have to tell them, go pick some. I want people, for me, it's always been leading by example. I will do these things. I will do them forever. If you pick up on the cues or not, it doesn't matter. Just know that I will always respect you, and I'm not going to yell at you. And I rarely have to ever discipline somebody, because I have always looked at discipline as a weakness on my part, to where I need to work with that person a different way, because the way that I'm doing it is not working. So if I do it a different way, and I've actually watched people completely turn their work around.
Wow.
If you've changed the approach into saying, and coaching them, saying, what can I do? You tell me what I can do to help, to be able to respond better to what's happening with your work product.
Okay. Directing traffic, you want to tell us a little bit about that?
Yeah, well,
was there a car broken down?
No. It was our farmer's market. So we had hundreds of cars coming to our parking lot with only 98 spots.
I gotcha.
So you have and none of those spots were allowed to be parked in, because we had the farmer's market in the parking lot. So how do you creatively use grass? Well, I learned very well in the Army. So I have a radio, and so does the team of individuals, and we absolutely, without a single accident, parked people throughout the entire property, through the Sheriff's Department and through Murray Ridge School, both two very gracious partners letting us use some of their property, and we parked everybody extremely efficiently.
I see.
Yep.
I see. Well, that worked out fine. Well, let me give you, I'm going to give you a series of questions that are going to be on a slide that
Sure.
the viewers are going to be taking a look at. And the first one is, what is the goal of Lorain County Public Health?
To protect anybody that lives, works, and plays within Lorain County itself. And the objective is really, it's an inclusive statement saying, even if you don't live here, if you're coming from Cuyahoga County or another county and you're coming here because you're coming here to work, we're going to protect you. If you live in this county, we're going to protect you. The programs that we have put in place are meant to envelop anybody that enters into this space and beyond, because there are some programs that we do. We provided translation services when Ukrainian refugees were coming in, because we have someone from Ukraine working with us. And so we gave them a phone, we provided those services, and most of the services were from Ukrainians that were residing in Cuyahoga County. So it doesn't matter. We don't look at a border. Because diseases don't have borders. They don't have any idea where the county line is. So it's an all-inclusive statement saying that we recognize all of these aspects of life, and our job is to protect everybody.
Okay. What about the mission?
The mission itself, it's for us. So that mission is to serve and support a healthier community. That's for the employees. That is only for them. That's really not meant for other people to see. So if I've told the employees that when you look at that and you have that at your desk, that is solely for you to say, why am I here today? I'm here to support a healthier community, to serve and support them. And we just redid these back in October, and there was a reason for that, is because our administrative staff said, we don't feel that the current mission applies to us in any way, because we never get to leave the office. We're answering the phones, we're doing this. And so we looked at that and we got everybody together and we said, that statement really does only affect those that get out of the office and work with partners. So how do we make this statement? How do I look at somebody that's answering phones so that they understand how important their job is? And they came up with this statement to where it's serving and supporting a healthier community. Mm-hmm. So that's that way. It includes everybody in the department. Any employee can walk in and say, "I know why I come to work today," and I'm either a person that's supporting them or I'm a person that's serving the people directly.
Okay. What about the vision?
Improving today for a healthier tomorrow. So we realized that when our community health assessment came out and that a lot of the numbers were going south, that we were actually getting unhealthier. It was we had to look at every day at a time. So when we were having the discussions on what our vision would be, is that we knew we didn't want to come up with something that was not reachable or attainable, where we knew that if we improved a day, every day at a time, that if we did something better each day, that eventually one person, two people would catch on at a time, and you're changing your community one face, one mind at a time. And that's what that statement says. Now, that is for the people to consume. So that is something that we will have where people, when they walk into the building, that should be in the next couple months, the very first thing that they see when they walk in the building is, what is our promise to you? That every day we're going to come in and not do a job. We're going to do a mission that changes your life for the better.
Okay. What about the values?
The values themselves, the most important one. There are some in there that you might find in other businesses as well. You're going to see those continuously improving. So you make a mistake, what can I do to do it better? The respecting everyone, of course you want to do that. Encouraging creativity. The health commissioner can't be the idea person forever. You want to look at your staff and go, tell me what you're thinking, because you have a really good idea and let's make it happen. Embracing diversity, and then working together. But the most important piece, the one in there that I left out, was the making data-driven decisions. So when somebody asks you, why did you make that decision? So every board meeting, there's always something that has to pass, whether it's fees or something else. And I've told the staff that we've changed our fee structure to make sure that you're using cost methodology. You're just not making up a number. You're saying, what does it actually cost to run that program? And then you work through the math. And there's an algorithm that we use to come up with that. And it's not a made up number. It's not meant to make money. It's meant to recoup the cost of that program. And the same thing goes with the programs that we're doing. So when I ask people, all right, what program are you doing? Not only A, I want to see how it relates to the social determinants of health, but B, how's it improving the community? Do you have any numbers? You put in a walking path. Well, how many people are walking that path? Did you advertise that walking path for people? Or did we just do a really good job writing a grant and putting a path down? Did we go to the second aspect of that? So that way we could report to the board and to the people and to you, hey, not only did we work on putting that path in, but we did this second piece in advertising it, then we did a fair walking it and getting people and encourage them and continue to do messaging to get them to walk it. And how did we get word around? So that is, I want to make sure that not only are we, that after we made a decision that we use data to justify it, but I want to make sure that if we're going to put in a path or whatever program we're going to do we talk with our community first to find out this is what they need? Do we have any data that shows that they need this? So that's what I want. Every decision that they make has to be data driven. I want data to associate with that decision.
Understand. What is the strategic plan?
Well, the strategic plan is, health departments really did, having been in it for so long, health departments really didn't do strategic plans for the longest time. We said we did, but it didn't really do one. And if you go through the real process of doing that, and that is where you're coming up with, where do you want to be in the next 3 years? What are the goals that you want to meet? And what we found out was that we have a good resilient workforce, and we have really good retention rates. But we also looked at it, we had an opportunity to, how do we better that? How do we say we are the premier health department? So you have to come up with different things in your strategic plan. What are you going to be working on? Are you going to be working on your people, working on the outside, working on your programming, working on your finances? Well, we had three main areas, and that was working on our programming, our people, and our finances. We've done very well financially to make sure that we operate very fiscally responsible. And when it comes to our programming, it had to be data driven. We have to say, okay, what do the people need? So we have new programming that's been coming out over the last year. But it was the people one where, you just got through COVID. Everybody was working double time. That they're stressed out.
Right.
So how do we unstress them? And so we came up with a program making sure that travel opportunities were available for everybody. So to go to a conference, money was being given by the state to be able to do that. We made sure that it didn't matter what position you were in the department, where do you want to go? You want to go to Atlanta? You want to go to, and we were able to do that. And a lot of times it was either covered by the federal government or covered by the state. Very little of it was actually covered out. Well, actually, in most cases, no levy funds were used for that. And it was meant to develop them, and they were being sent to trainings that they were never able to go to before, and learn more about their job, to be able to network. And what we got back was great. I mean, we got back people that they're coming back happier. They're coming back wow, I just learned this at this conference. I had no idea we could do this. The things that it expanded by being able to send our finance team and other individuals to go to auditing classes, things like that. What we got back from that was well worth maybe the $200 it cost to be able to send them to it. And it was something they never got that training before. It was something maybe they would have gleaned off another employee after 25 years of service. And here, you got it instantly. And that was just one thing. And we looked at, or what do we do with the education piece? And we applied for every grant to be able to send employees to go back to get their master's degree or a certificate in anything, and then be able to pay for it. So there were two different methods that we have at the department. That we have the state that's providing money to an organization that we work through, that's covering up to $5,000, and then we cover 80% for an employee to be able to go back to school. So it was developing them. That's what that strategic plan is.
Well, good management.
I hope.
What is the Lorain County Community Health Assessment, or CHAS, and how is it prepared?
The CHA is the people's voice. So the community health assessment it's done with using focus groups, done with using questionnaires of Lorain County people and her citizens. And they tell us what's wrong with them. They tell us, this is what I'm affected by. They tell us, I want a doctor to look like me or speak like me, or I want better transportation to medical care. So we take all of that and we do it over about a year period. We started in January of 22, late of 21. And by August of 22, we were doing our draft, and we came out with our final in late August. And then we had a presentation on the community health assessment to the general public in September of 2022. So it's prepared internally. It wasn't before. This was the first time it was done internally. Usually the department had hired someone to come in and do this assessment. We wanted to do it internally. We really do have a really good staff that there was a lot of tears. I will tell you that it's one of the most stressful things to go through. You're reading what a lot of people are, you're reading the personal information that people have trusted in you to tell you how they feel about their health, what's affecting them, and you're trying to process hundreds of voices and they're trusting you to put that into words to tell the community how they're affected. You take that community health assessment, you share that with everybody and your partners, and it's our responsibility in public health and the hospitals and mental health providers. It's our responsibility then by law, we have to do this by law, to come up with a community health improvement plan. So you start with the CHA and you take that information and you put in a plan on how you're going to fix what they told you is wrong. So that community health improvement plan it's run by a steering committee of all the hospitals, the health department, mental health component, and our objective is to look at each of the goals that have been put together by community groups. So community groups so let's say our cancer group. Cancer is one of our 5 important things, and it's substance abuse, the mental health piece, infant mortality, maternal and child health. Each one of those have a group, and they get together and they say, here are the goals we think, if we meet, will reduce infant mortality or reduce cancer risk.
Okay.
And they then bring that to the steering committee, and we're like, let's go, let's do it. And we all get together and put some funding in it to make sure that we can do those things. So like cancer screening events, one took place on the 15th where all the hospitals got together, public health. I was dressed as Dr. Barkley the dog. And I love this stuff. And I was great pictures of me in a big, huge blow-up colon. But we get together and we do these events, and we do what our groups tell us need to happen, and they're the ones that have their ear to the ground, that say, this is what our community is telling us, and if we do this event, we might be able to reach more people and reduce this disease.
Wonderful, wonderful. Tell us about the mobilizing for action through planning and partnership process. It's MAP.
Yeah. So when we get everybody together and you're really trying to get that action piece out there and say, here are our set of goals, and this is how we're going to deploy them in the community. And it's a good piece of it is making sure you have that correct audience, and using different aspects, using different platforms. So whether it's social media, whether it's in person, it's ensuring that you get the message out there in multiple different formats and that it has an action associated with it, that it's not just talk, and that you want to be able to show that in the end, here is that product.
Okay. What are the priority areas, and I think you've mentioned them, identified for public health outcomes in Lorain County? I think you've named them already.
Yes, sir. The one when we're talking about cancer, maternal and child health, the substance abuse, the mental health piece, and the readiness for school. So it's when it comes to children and ensuring that when they get the kindergarten readiness or get the kindergarten, that they're able to start out right away.
Okay. What are some of the improvements in Lorain County's population health? That's some of the improvements.
Well, none.
Too
none,
bad.
None yet. So it's what we're finding though is, well, one thing that is new is the way that we're collecting data and reporting out on that data. So that's the new piece. So we don't have any measurable positives yet.
Okay.
But because we're just implementing these programs. I mean, this was the beginning year of these new ways that we're doing the cancer screening piece and everybody working together. So it's you're starting to gather that data now. So it's also the first time that the hospitals and the health department are sharing that data back and forth. So this is the first. That's never happened. We've all agreed as the CEOs to be able to say, okay, how do we share this information? When it came to the promises, I promised the hospitals, I'll incur the cost. I just need your data. So what we did is we hired an entire epidemiology team. So we have a 3-person team.
Wow.
One that's a data plotter, one that's a storyteller, and one that knows how to gather the data. And there are 3 experts in their fields, and they work together in this tight little unit, and they produce some of the nicest maps, amazing maps, where I've even brought them to Avon Lake City Council, where if you look at the number of overdoses, and if you say, okay, within the city limits of an area, I might only have 6 overdoses. But when I show you a map that only 2 streets over, there's 26, only 2 streets over. That gives you an that way the border goes away and you look at, wow, I'm just 2 streets away from having the same problem my community partner has.
Okay.
And that is, when you visualize something like that, you change a person's perspective on where do I need to go from here.
Okay. And now the kind of the bad side. What is the overall trend and some of the key health outcomes that were worse in the 2022 CHA as compared to other CHAs?
Sure, and that would be cancer, stroke, infant mortality, diabetes, and in each of those categories, and even suicides and SUD use. I mean, we went from having 10 overdoses 12 years ago to 240 and beyond. So it's gotten worse every single year. Our infant mortality took a dip. And then after that dip in 2016, it actually started to go back up again. And then the disparities between white and black babies started to go almost double. So in the state of Ohio, it's almost triple now that our black families are experiencing 3 times as much infant mortality than white families or other races even. So it's in Lorain County, we're experiencing the same thing that the state is experiencing, but that's unacceptable to me. I mean, I can't stand that, and there's no way I'm retiring without that being fixed. I've said to everybody, there's no way in 3 years that's an acceptable number to me. I can't be acceptable to anybody. It just can't be. Anybody listening to this should look at that and go, it is not a statement that somebody can make and just say, well, we have freedom, anybody can just go to that is just not a fact in this country, is that people have the same access to everything. It is not a fact. It is absolutely the opposite, that there is a difference when it comes to healthcare and access for people of different races. And so it is unacceptable, and that number is unacceptable to me, and it upsets me.
It needs to be fixed.
It needs to be fixed because it's fixable, and it really needs to be the focus instead of all of this other drama that goes on that people worry about.
Okay. Well, I'll change gears a little bit. Is the increase in heart disease in the younger population related to obesity?
Well, I don't know of a direct tie to that. So what we don't know, some studies will show that yes, but other studies will show stress. Other studies will show poor eating habits. So it's really, there's a lot of reasons why that, but it's a shocker to see that we're now experiencing heart disease younger, 10 years younger than we were at the last community health assessment. You would expect 65 and older, but to start seeing 45 to 55-year-olds with heart disease that usually their older counterparts were experiencing is shocking. That should shock anybody that is in that age group. I'm in that age group at 54. That should shock any, and that's 54 is when my grandmother died of heart disease, and that should shock anybody. That we're actually that rate of heart disease is going up like that.
What about is the increase in diabetes related to diet?
Well, with diabetes itself, there's always that factor of diet. There's that factor of genetics, the factor of drinking, smoking. So we absolutely, each of those, we are affected by what it is that we eat. So especially with the show being Common Sense, for anybody out there, if you're eating fast food every day, maybe we've lost that aspect of common sense that it shouldn't hurt you, but if I could tell anybody out there, the sodium content in that, or in pizza, or in diet pops or pops, is astronomical, and that that is absolutely a huge factor in us experiencing poorer health outcomes. Just not just the food piece, but lack of exercise, the lack of getting in 10,000 steps a day at a minimum. People have just kind of given up on that, and they're not doing that piece. So lack of exercise and poor eating habits.
Okay, why is the suicide rate increasing?
That we don't know. So that is what is causing people to feel like they've reached their limit, that they can't take it any longer. I know that I'm entertained sometimes by the stickers that I see on the back of cars. Today I saw one that said, "We the people are upset," and I thought, upset at what? How bad is it? And
the sun's out.
The sun's out every day. You have a job. We have low. We're letting all those other things take control, and we didn't have. I remember when I started driving, we didn't have road rage. I don't remember that. It wasn't even a word when we were going through driver's ed, and now a person is willing to pull out a gun and shoot somebody else, or take their own life and ruin other lives because somebody cut in front of you. We are not thinking as a society. We're just not putting a lot of thought into what we should be putting a lot of thought into. We're focusing on the id and the ego, and we're supposed to let that stuff go and be able to focus on community and preservation of our community and our way of life, not, well, I'm upset who got elected in, and it just focusing on the wrong things.
Yeah. You mentioned this before, but maybe you can go back over it a little bit. The community health improvement plans, the CHIPS. Now, this is the plan for moving forward.
It is. This is the driving force for all of our organizations, the hospitals, the mental health piece, the health department. This is the plan that it's our promise from this level of your service providers in the county to the people that says, we heard you in what you said in the community health assessment, and here is what we're going to do to fix these pieces.
Okay. Now, what plans exist to address the health priorities for 2023 to 25?
Well, it's a number of activities. So each one of those groups had to come up with various activities, and I gave you an example of one where we increased the screening. So instead of having cancer screening at this location, we decided to have them at multiple locations and have joint screening. So this year it was held at Lorain High, which is where instead of having it at a downtown area, you have it in the middle of a residential area. So each one of those things, each one of those priority groups are coupled with activities. So they're having, whether they're doing eating healthier, the farmer's market, when it comes to diabetes. That hits on not just one thing, but that hits on diabetes, it hits on heart disease. There's a ton of walking. If you're a participant and you're coming to those farmers markets, you're being introduced to vegetables and fruits. you're also having to walk a lot. You're getting in steps that day because we don't put booths right next to each other. We're making you walk back and forth. And it was hundreds of families, and it's continued to grow each year. So we know people want this. We know it. When you're watching 250 families walking in and they're bringing their children, one mom was by herself and she had all 4 of her kids with her. And I just looked at her as she was walking past me and I said, "You're mom of the year right now for me." And and they were all young. They were all under 4 years old, 3 or 4 years old.
Did you have them on tethers? Or?
Nope. And they knew where to go. Nobody was wandering around. They knew that mom was running the show.
Okay.
And so as they walked with her, they didn't get further than 3 feet away from her. And when you bring your entire family, think of the habit you just taught them, that you've brought them to a place that you're attending events and you're buying vegetables. That's all I want. That's all I want Lorain to do. Go buy some vegetables, go buy some fruits. If there's a problem you can't afford, give the health department a call. Maybe you qualify for the WIC program. But when you're seeing that, that's how you change the future. And the parents are the driving factor for changing that future.
Yeah.
So, but yet we also make you walk. So you're hitting the cardiovascular, the diabetes, and hopefully infant mortality, because we had a lot of pregnant moms there as well.
Wonderful. That sounds wonderful. How can someone access the CHA, the CHIPS, and related documents that the public health has to offer?
On our website, loraincountyhealth.com, and all you have to do is go to the search and type in community. Probably just one word will get you there. Or you can just type in CHA or CHIP, C-H-A or C-H-I-P, and you'll be able to download the entire document.
Okay.
And our strategic plan and a lot of our stuff.
All that stuff.
Yeah.
Where is the Lorain County Department of Health located?
At 9880 Murray Ridge Road in Elyria. So we're at the top of the hill. It's a sort of a lighter color, silver white building, and lots of windows in the front. So come on down. Come and visit your department.
Okay. How can someone get in touch with you?
They can give me a call. Are we talking in touch with me? Because I usually give out my cell phone if people want to talk to me.
Well, I've got the number 322-6367.
Right. Yeah, that's the main department number, 440-322-6367. But I've never. People think I'm crazy for giving out my cell phone, and I've always done that. If anybody needed to call me, I'll talk to anybody, and they have no idea.
And I've got M. Adams at LorainCountyHealth.com.
Yep.
That'll appear at the bottom of the screen,
yes,
so viewers can see that. Mark, in summary, what's making sense to you and what doesn't?
What makes sense to me is I still see. I'm an optimist, so when I'm going through the community and I'm talking with people, I see the positive. What doesn't make sense is the focus that we have as a society on the negative. We really do. And we have so much good that goes on. You watch any news station and I still do it to this day. I'll start the stopwatch to find out when they say something positive. And it'll go at least 2 hours on some news channels without saying a single positive word.
Right. If it bleeds, it leads.
Yep. And we have let that happen as a society. Yep. And it's directing us, not just that, but just in the way we talk to each other. We want to talk about we want to do the gossip rather than say, here's something positive that happened. I had a positive interaction today. You asked me what I find fascinating in my job, and I told you today is what I found fascinating. And every day something like that happens, and I get to experience that. Somebody asked me another thing today. They asked me, do you celebrate today since it's your birthday? I go, actually, no. At my age, I celebrate every day. So I don't really tell anybody it's my birthday. But yeah, why not? Why wait till just one day? I know somebody might be watching this and he's driving me crazy, but really,
every day you wake up is a great day.
Every day we wake up, it's a great day. I mean, why not focus on something positive? Why be so just morose of every day and let the negative run your life?
When people ask me how I am, I say, never better.
Yeah, absolutely. I could have, the military offered me an out when my brother was killed in that car accident. I was 17, and they said, you don't have to go. We're going to let you out of your contract. You don't have to go to basic training. You don't have to enter the military. We understand. And I have a stepmother, and she said to me, don't ever let the negative define the rest of your life. And I was surprised that she said that. We actually had a very contentious relationship. And she said that to me, and it was probably because she wanted me out of the house, but at the same time, she said that was very profound to me. And so everything that's happened negatively to me, I've always made sure I talk to people about it, because maybe I'll change one person.
Yeah. Well, I'm sure the citizens of Lorain County and I am very grateful that people of your caliber are now heading organizations that protect us.
Thanks.
And so I'm very impressed by you, and I wish you the best.
Thank you, sir.
And please keep doing what you're doing, and I'm sure there'll be improvements. I know that next year about this time, I'll ask you to come back on, and we'll talk about the improvements that have happened.
Yeah.
Just because of
or you're going to see a very embarrassed person here.
No, I'm very confident. I'd bet the house. Borrow money from the mafia, too.
Oh.
Well, thank you for watching, and thank you, Mark.
Thank you.
Please, if you have comments, please give us feedback on the show. If you would like to come on the show, or you know some interesting people, please send us their contact information, and we'll take it from there. And remember, seatbelts save lives.
The preceding program was presented to you by a community producer. The statements, views, and opinions expressed were not necessarily those of ALC TV or the City of Avon Lake.